Hello. Here I am. It's 3 weeks post-surgery now, so I just thought I'd give you a bit more of an update. The more observant amongst you might have noticed that I still have my little handbag. This was unexpected. So I went back to Sydney at the 2-week mark to see my surgeon, well, in fact, to see his nurse for, inspection of the dressings and to have the vacuum part out. So you might recall in the last video I showed you that I basically had plastic wrap from here to here, and that there were these spongy dressings over the big abdominal wound. And then there was this thing plugged into the center of that was sucking on it to bring the wound together, to keep it all nice and firm. And the idea of that is that you get a really nice, fine scar out of it. So that was all on there. And then at the 2-week mark, went up to Sydney. The nurse took all of that off, inspected all of the wounds, and went, yep, 2 thumbs up, looking really good. There was a bit of granulation, that is sort of scabby type material, and some areas that were still a little bit raw, right in the center of the big abdominal wound and also in the belly button area. So I've been every day dabbing on some betadine onto that and then redressing it. I can at least now stand under the shower as long as I've got my back to the shower, because I've still got tape, which I'll show you in a minute. I've got tape all across the abdominal wound. I've got dressings still at the drain site, and I've still got dressing on the belly button and underneath the boobs. So, I have to be careful not to soak those too much. If it's just lightly wet, I can kind of pat them dry and dry them with the hairdryer. So I still got, I've got dressing tape, I've got dressings on all of the wounds as they continue to heal. And those will probably be on there at least till the 4-week mark, maybe a bit longer. But what was unexpected was still needing to have this surgical drain. So it's coming out of, what I might do is I'll pull all the gear off, and I'll show you what's going on without losing my microphone here. So just give me 1 second and you'll get a better idea. Hopefully this won't make the sound too crappy, but now I'm still wearing the abdominal binder. So take the abdominal binder off. That's to prevent too much in the way of swelling and fluid collection in the belly. I'm not sure how effective it's being for reasons that I'll explain. So here we are. This is tummy. As you see, all of the plastic and stuff has come off. Now, I'm not sure. I might have to show you by standing up a little bit here. So what I've got is I've got from here basically all the way around this hip here, all the way across. I've got down to here. That's all the cut where the panels of abdominal tissue were taken away, and then the top part was brought down and the bottom part was sort of joined together. Then we've got the new belly button that he's created in the middle here, and off to the side here, where this is disappearing into my undies, is where the drain's going in. And unfortunately, the problem is that they can't take the drain out because the drain's snaking its way right through, the whole wound, collecting up any fluid that collects in there and taking it away. And they can't take the drain out until it's producing less than 30 mils a day for at least a couple of days. And it's stubbornly sitting at 100 mils a day. It just won't go down. Then the other little issue that I had was because as part of all of this, they know that you're going to be tight and inflamed and that there's going to be seepage of serum and fluid. They want you to do what's called lymphatic massage. So, they get you to do all these things where you're kind of rubbing and encouraging drainage of fluid through the lymphatic system. And while I was doing that, one of the exercises was to sort of push down through your groin area there down into your thigh. And I noticed that it was quite lumpy down there. Now, I assumed that was lymph glands, and it probably largely is. But when I reported it to the surgeon, he wanted me to have an ultrasound scan, because one of the things that they worry about is that you might have a big collection of fluid in there somewhere that's sort of walled off and forming this big lake inside that needs to be drained, because it can be potentially a site of infection as well. So what they call that a seroma. So because he was concerned about a seroma, he got me to go and have an ultrasound scan. And if they'd have seen anything that was worthwhile draining fluid out of, they would have stuck a needle in there and drawn the fluid out at the time. So what they discovered was that in this, underneath, we've got the wound here, and then these areas here on me at the moment going down into there, they're actually got quite a bit of fluid build up in there, and the lymph glands are a bit swollen as well, but it's not one great big sort of open lake of fluid that they can easily drain out. It's sort of like lots of like a bunch of grapes, it's all kind of partitioned off, and so they would have to put a needle in lots and lots of times to get it, and it would probably reform. So at the moment, while I've got the drain in, they're not going to do anything about that. I've gone back to kind of, which I'll put on later, I've got some very, very tight, like post-pregnancy shorts that help to kind of compress and support you. And so I'm going to be wearing those today. They sort of put some pressure over the thighs and around the bottom of the pelvis and tummy there. And I'll also put my TED stockings back on, the ones that they gave me at hospital, and just try and keep all the fluid from all building up. Because the other thing is that I'm sort of back at work in my home office here, and I'm sitting upright all day. By the time I stand up in the evenings, it's really, really uncomfortable. It feels like all this pressure's built up in my pelvis because of, any fluid that's in there is sort of down the bottom of the pelvis and pushing down, and also going into the top of my thighs at the moment. So, there's a bit going on. I'd really, really like to have this little drain come out, but the plan now is to go back to see the surgeon again in Sydney next Monday, which will be nearly 4 weeks post-surgery. And then he'll have another look at all that situation, and hopefully between now and then, which is, it's only about 5 days away, hopefully we'll start to see gradually that drain output coming down enough that the drain can come out. But look, as you can see, I'm quite well in myself. My energy levels are reasonable most of the time. I'm able to do some work from home again now. And excitedly, I'm able to drive. And the reason why I'm so excited about that is we're picking up a new car today. First new car I've ever bought in my whole adult life, and I'm so excited. And I'll actually be able to drive it today, which will be very nice. So yeah, look, fully functioning in most other ways, still fairly uncomfortable, having to lie on my back in bed to sleep, which I really don't like, because I'm a bit of a side sleeper, but I can't afford to put any pressure on the chest area. But yeah, all in all, going along pretty well. I'll just be really interested to see how this plays out in terms of, the results, because I know that when I see the surgeon at the 4-week mark, he's going to be sort of taking an objective look about how, how everything looks. Are the boobs looking the way he wants them to? Are they even, hanging the way they should? Are the nipples in the right position? Is the belly button in the right position? All of those kinds of things he'll be assessing, because typically what happens with DIEPs is that most people end up going back for a second surgery down track, 3 to 6 months later, for tweaking, we've got the basic boobs in place now. Then it is like, oh, okay, well, this one could be a little bit bigger, or, maybe we need to adjust the nipple position or something like that, or add some extra fat in certain areas if it needs a bit more filling. There's different things that they can do. So I will check in with you again after I've seen the surgeon at the 4-week mark and tell you what he said about all of that.